Congressman Fred Upton hosted a roundtable discussion with some big names in the medical field today at the new WMU Med School. This coming after he launched a new bipartisan initiative to help improve the process in which medical treatments are discovered and delivered to you, the public. 24-hour News 8's Mark Thompson was there and has details now from the newsroom. Mark?
Partisan legislation that will streamline the process which medical treatments are discovered and eventually make their way to the patients that need them the most. This morning's roundtable discussion at the WMU Medical School included top government health officials, researchers, and drug companies. Right now, there are over 7,000 known diseases with only 500 treatments or cures. Upton points out that it takes nearly a decade and $1 billion to develop new drugs before they can be used to save lives. And he says that that's too long. In the meantime, investors are taking their research dollars overseas where there are fewer roadblocks.
We found a whole number of different companies that have gone overseas. And of course, if those drugs get approved overseas, guess what? That's where they're going to manufacture them. We want the jobs here.
And Congressman Upton went on to say that, diseases, they have no political party, so they hope to have a bipartisan bill before the president by the end of next year. Now, one member of today's roundtable discussion was Dr. Francis Collins. He's head of the National Institute for Health, a government agency with a $30 billion budget that's working hand in hand with the CDC on the current Ebola outbreak. He says there's no cause for Americans to panic, but the situation in West Africa is dire. The NIH is on the research and cure side of the equation, and while there is no known cure for Ebola, he says that they're working on it.
Right now, there is no proven cure. There are 4 or 5 therapeutics that look like they work in an animal model, but they have not been proven to work in humans, and that's something we are trying to do, although it's very difficult to set up those kinds of rigorous clinical trials in such a chaotic situation.
And Dr. Collins says that the most effective treatment right now for patients is to keep them hydrated, as most victims die of severe dehydration and low levels of potassium. At the live desk this noon, Mark Thompson, 24-hour News 8. Back.
Mark, thank you. Our coverage